Earlier this evening, the CDC advisory panel announced its recommendation for who should receive the first doses of a COVID-19 vaccine as soon as one gets the okay from the FDA. As Jay Gray tells us, the vaccines are desperately needed, with infections and deaths climbing.
The CDC Vaccine Advisory Committee is recommending the first vials of coronavirus vaccine go to residents in long-term care facilities and medical personnel, ahead of expanded distribution of millions of doses, which could take months. Across the country, the need for the vaccine is growing.
Sadly, we're already seeing the impact of holiday travel in a bad way, with record numbers now of infected people, hospitalized patients, and sadly deaths from COVID.
Medical facilities are running out of beds. In some hotspots, field hospitals are being deployed.
It's really reaching a dire situation.
The Department of Defense sending military medics into areas to support staff overwhelmed by the surge.
Things were steady, and then all of a sudden, boom, we're seeing community members coming in. They can't breathe anymore, so they come into the hospital, and it just seems to be nonstop.
Doctors warning the holidays are a very high-risk season.
The challenge is that vaccine is going to take many months to roll out. And in that time, we have to be extra careful.
With the virus still spreading in some areas at the highest levels since the start of the pandemic.
People around the world are anxiously awaiting a COVID-19 vaccine, and authorities say scammers are trying to take advantage of that. Homeland Security is working with vaccine makers as they get close to distributing their vaccines and scouring tens of thousands of websites to be able to spot fakes. Back in April, people were scammed into buying phony PPE gear, fake N95 masks, and even false cures for COVID-19. Fortunately, so far, officials say they haven't seen any incidents of fraud with a vaccine yet.
HSI has analyzed over 60,000 websites that were suspected to be involved in some sort of COVID-19 related fraud. We want to make sure that we're working very closely with the pharmaceutical companies to ensure and protect that supply chain and to ensure the American public are safe.
Officials say desperation for the vaccine makes people more vulnerable to scams, so be sure to remember, if something seems too good to be true, it probably is.